It's Dr. Page, the best guy to see on the worst day of your life. And I just want to thank you for walking along with me in your healthcare journey. This is the Navigating Healthcare series, learning to take control of your health. And we've discussed a lot of different topics. Today's topic is going to be discussing how to filter the facts from the fiction. You know, nowadays, in our age of information, everybody has an opinion about a certain health condition. And you can find all kinds of information. The challenge is being able to filter through all that information and understanding exactly what are the most rational, efficient steps that need to be taken in my personal specific healthcare circumstance. I'll never forget this story. One day I had a young college student come in to the office, and she had this little sore on her leg, and she says, "Doctor, I believe I've got Bilharzia." Well, once again, we're in rural East Texas, and Bilharzia is an entity, is a disease that's found in sub-Saharan Africa when people are swimming in contaminated, kind of stagnant water. And so as I began to go through all the questions, so have you ever been to sub-Saharan Africa? Have you ever swam in any stagnant water in sub-Saharan Africa, maybe in Zimbabwe or something like that? And of course the answer was no, no, no. But then she showed me the picture that she had found on the internet, and she showed me the ulcer, and it was, although it looked similar, it didn't really fit. So nowadays we have all this information. Even when we're in the hospital, everybody has an opinion. Even the lady who may, bring your health tray and bring your lunch into the room. I mean, she has an opinion. The lady that sweeps the floor has an opinion, and the nurses have an opinion. And so, how do you begin to filter out all this information and make good decisions? And I want you to understand one thing, that not all opinions are the same. You have to be able to prioritize those things. And so, once again, ultimately, you need to talk with your provider about those things and ultimately make those decisions with your provider, understanding that even in the hospital often, there are different doctors, and, Dr. A says, gives you this thing, and it seems like Dr. B is giving you something that completely contradicts what Dr. A said. And so how do you filter all these things? And I think it ultimately involves around, once again, being your own health care advocate, keeping a journal, asking good questions, and I think that will help you through the process. What I want to encourage you with today is just helping you to prioritize all that information, once again. And I think there's some good questions to ask. And, once again, in medicine, we base our practice not upon anecdotal, our experience, although that's important. We also base that upon studies. And so the first question you need to ask is your physician or your provider is, well, have you ever seen this before? Have you ever experienced this before in your practice, a specific situation like mine, and how did that turn out, and what were the treatment options? That's one level. The next level is to go into the evidence and to the facts. Do you know of any studies that pertain particularly to my health problem? And and then along with that, begin to ask the question, do you have any kind of literature that I can read? Or do you have anything, maybe a website or something that may help me? And if you kind of begin to ask those questions, between experience and evidence, I think that will help you a lot to begin to trust your doctor. Understand, like I've said before, you talk to 5 different doctors, sometimes you get 10 different answers. I mean, everyone has an opinion. Not all those opinions are valid, and not all those opinions may be the best. But then you need to also ask those questions to your physician. I think another thing is to understand that it is not wrong to ask for a second opinion. I mean, and when do you ask for a second opinion? Well, sometimes when you can't distinguish between facts and the fiction. When you have two different opinions about how to proceed. Sometimes it's not even wrong to ask for a third opinion. You know, whatever you need to have the assurance that you're making the right decision. You know, when you're having a breakdown of communication with your physician, or maybe when you've had a loss of trust, you know, and sometimes that happens. I mean, I've had patients that I've done a surgery on and everything falls apart, and they've lost my trust. And in those situations, sometimes it's better to get another opinion, either to give you reassurance that, you know, all the right things are being done, or that maybe we need to take a different direction. And so, I think those are all questions that we can ask. Once again, there are no formulas, for knowing and how to filter all this information. But it really boils down to your relationship with your doctor and having that trust. You know, we had an old surgeon here in town when I moved to our small town. And, once again, I was the newfangled doctor at that point, doing all things with the laparoscope and small incisions and, minimally invasive approaches. And this old surgeon, I mean, he was old school, man. He would just, take a chainsaw and, cut you wide open. But, one of the things I found over the years as I watched that doctor is I realized that his patients did extremely well. I mean, he had been tried and he had earned people's trust. And so often you need to realize that when a physician gives you an opinion, sometimes that is based upon their experience. There's nothing wrong with that. But it's never a bad idea, too, to ask around, about physicians and to learn about them and just, ask your doctor and communicate with your doctor. That's the best thing that I can tell you. That's the best advice that I can give you when you're trying to filter out facts from fiction. I'm Dr. Page, the best guy to see on the worst day of your life, and this is session 5 in the Navigating Healthcare series.